We all have been affected by cancer in one way or another. We are either ourselves battling cancer, we have a loved one that's battling cancer, or we've had someone that has gone through cancer. And to be honest, it's a difficult time. As a general practitioner, I am privy of the fact, and I've worked with people as well, my patients who have cancer, or we together have picked up a lump, it's been investigated and found to be, let's say, breast cancer. So in today's video, I'm essentially going to talk about how to self-examine your breast, because I do know that breast cancer is one of the leading causes of cancer and even death in a lot of the women, both in the first world but also in the developing countries. And this video is in memory of a dear friend. I myself have lost a dear friend. This is in memory of you, Dorcas, so that you know that you're gone but never forgotten. And I hope that from this discussion or from this video today, somebody somewhere will be able to get the much needed information to do what is right, and hopefully, if they have cancer, catch it early and get treatment early. So if you're watching me for the very first time, my name is Anna, migrant doctor mom. I am a general practitioner, I'm a doctor, I'm a migrant, and I'm a mom. And so I talk about various topics. And today I'm talking about this health topic because I know it affects a lot of people, and more so those of us of, foreign descent, African descent, mostly because our screening and how we seek screening, or even just our health-seeking behaviors may not, be like the Westerners. And when I say that, it's essentially when I see very few, even here in Australia, I see very few people of the African descent, and also other, with the screening and stuff like that, very few people actually get screened. As a matter of fact, you, my viewer, do you know anything about screening? And if you do not know, that's fine. That's why we are here today, to cover this topic and hopefully give you the much needed information to help you in your health-seeking behaviors. All right, so we'll just quickly dive into it and cover as much as we can. So today I'm essentially talking about the various signs of breast cancer, and just essentially how you can self-breast exam, and so that if you pick something, you can see your general practitioner or your doctor and have it assessed. Okay, so I am using various two references. So one of them is Know Your Lemons, and the other one is the McGrath Foundation. So essentially, when you look at McGrath Foundation, it says if you grow them, you should know them. We all know that breasts are for various reasons, nurturing and all that. But if you grow them, and we all grow them, both men and women, we grow them, so we should know them. And by this is essentially when you're screening and self-screening or self-breast examination, you need to look, you need to feel, and then you need to learn. By looking, essentially, you're looking to see if there's anything that's different, all right? And by looking, you can do this in front of a mirror, stand up, look in the mirror and look at your breasts. You're looking to see if there's anything different. So you look and then you raise your hand up, raise your hand up over you like that. See if there's any dimpling, see if there's anything that's different. And I'm going to show you the signs of the things that you look out for that would be concerning. So look at the shape of your breasts, look and see if there are any changes, and look even as well as in your axilla. The next thing you need to do is feel your breast. And when you feel your breast, you're using your pads of your fingers, you're not using the tips. and you feel your breast, you need to do it in a systematic manner. I like to do it in sort of a clockwise or anti-clockwise manner. So I like to, put my hand up there, feel my breast from one corner, go all the way, go all the way, go all the way, all the way that way, and finish off with the tail of the breast. And do the same thing on the other side. And at the end of it all, feel your nipple, see if there's any nipple discharge, any areola. And maybe I should just tell you, like with the breast, there's the breast, and then obviously the dark area is the areola, and then there's the nipple. So look at the coloring around your areola and look if there's any nipple discharge. Very important to do that. So look and then feel with the pads of your finger to see if you can feel anything. Sometimes with bigger breasts, you can feel lumpy things, and that's why it's important to see someone to examine you, a clinician to examine you, and so that you know if that's your new normal, then you know that that's your normal, okay? After that, obviously, after you've looked, you've felt, the next thing you need to know is you need to learn. You need to learn what is normal for you. You need to learn, if there's one size that's bigger than the other, you need to know which one it is and stuff like that. So very important to look, feel and learn what normal breast is for you. Because we are different sizing, different, contouring and stuff like that. And then after that, if you feel anything that's untoward, then obviously you need to see your clinician. I say this with a lot of, sadness in my heart, because I told you at the beginning, I'm doing this in memory of my dear friend Dorcas. She felt a lump and she presented to a clinician, and she was failed, I must say. But that notwithstanding, if you feel a lump, you need to get it investigated. And with us as general practitioners, if there is any suspicion of a palpable, if the patient has felt it and you felt it, the next reasonable thing is to send it forth for investigation, where they can either decide to do the initial, mammogram, ultrasound plus or minus a biopsy if anything is picked. So very important, do not snub any changes. Insist and seek a second opinion. If you know your breasts, and because you're growing them, you need to know them. And if you know your breast, it's very, very important to insist that this is not normal to me. Again, I've had a patient that has come through what looked like just an infection of the area. And I just palpated it, and I actually thought it could just be maybe an abscess. And she'd done screening and all that. But then when I sent her again for an ultrasound, it turned out to be cancer. So it's very important, if you feel something that's not what is normal to you, see your clinician and insist for it to be investigated. And if that's not happening, seek a second opinion. At the end of the day, you grow them and you know them. So what are the signs of breast cancer that you look out for? I would like you guys to look at Know Your Lemons Foundation. It is quite a very good, has good information, good literature on there on what is normal and what's not normal. So when you look at Know Your Lemons Foundation, they've done it very well in a sort of, a lemon sort of crate, 12 signs of changes in your breast. And one of them is you may feel a thick mass. You may feel an indentation, which is essentially your breast is gone in like that. You may feel some skin erosion. You may see some redness or heat. You may see unexpected fluid coming out from your nipple. You may see some dimpling. You may see a bump. You may see some veins that are more pronounced. They were not there before. You may see a nipple that's gone in, which is retracted. You may see a new shape or size. You may see an orange pale skin. And you may see a hidden lump. So if you see and feel any of these signs, do not wait. See somebody. Have it assessed. Have it checked out. Have it looked at. Because obviously, by looking at it, you get assessed. And if you need to be investigated, you'll get investigated. Don't have second thoughts as long as you know your breast. Do this every once a month. And before you realize it, you will know what is normal for you and what's normal for you. Okay, and hopefully I will give you another video on how, screening is done. And I say this with utmost humility. There are screening pathways here in Australia. There are screening pathways even at home, in my country. And I am sure and I'm hoping that if you're watching me from a different country from what I'm used to, I'm hoping that there are screening methods as well in your country. And essentially, it's a mammogram, an ultrasound, plus or minus a biopsy if there's something that is wrong. So, in summary, examine your breasts every month, look at them, feel them, and learn them. And know the 12 lemon signs of breast cancer. And if you have any of them, do not hesitate to reach out to your practitioner. Thank you so much. Dorcas, you're gone, but never forgotten. Thank you.